I will be the sunlight in your universe. You would think my love was really something.
Music is really something. Hey there, everybody. How's lunch going? Yeah, you had a whopping 10 minutes. You all look very comfortable.
We don't
My name is Jeremy. As it was said just a moment ago, I am a CF father. I am also one of the National Advocacy co-chairs alongside my wife, Rachel, and our friend, Marissa. And it's a great honor to be able to attempt to entertain you during your lunch today. Who are you?
Hi. Hi, I'm Mary Dwight. I'm the Chief Policy and Advocacy Officer at the CF Foundation, and delighted to be in my hometown of Colorado.
It's probably a little bit helpful for you to know a little bit about who I am. So I'll give you a little bit of what everyone does in the CF community, which is so great, which is to share our story. My wife, Rachel, and I have been married for coming up on 23 years. In 2007, we had our first son, Asher, and like many of you have experienced, we found out that he had cystic fibrosis through a newborn screening. We actually have had 2 additional sons with CF since then. Paxson, who was born in late 2010, and we actually lost at 11 days of age. And then our youngest son, Beck, who just turned 11 on March 16th, was born, 11 years ago. So you can do the math and figure it out from there. And we've had what is probably a fairly common experience, I think, in the CF community of trying to navigate what it looks like to be able to manage a very complex, a very sprawling disease, trying to get our arms around what it looks like to care for them on a day-to-day basis, trying to keep our head around research and the promise of things that are coming down the pipe, how we can engage our community. We've gotten obviously involved in advocacy with you and your team, which has been a great blessing for us. But I think one of the things that has been surprising that honestly nobody really prepared us for was the absolute insanity of the complexity of navigating the healthcare system on a day-to-day basis as a parent. Am I the only one that has experienced that? Okay, that's good. That's good. I'm not alone. I think we knew that taking care of our sons would be difficult. I think we knew that we would have fears related to their health. I don't think we understood how complex, how expensive, and how grinding trying to stay on top of healthcare is. And honestly, it feels like it gets worse every other day. Mary, am I crazy? Are we the only ones?
You're not crazy, and I think looking out and hearing some of the commentary already, you're not alone. I think maybe it might be helpful if we step back a little bit, right? Healthcare is a huge portion of the US economy, and cystic fibrosis operates in a small sliver, although a noticeable sliver, of this big system. So maybe if we can just sort of step back for a second, you're not alone. This is a chart of healthcare spending growth. And wow, there's really kind of one direction it's going, isn't there? Healthcare in the US is expensive. The US spends more per capita than any other nation. And for patients, for families, out-of-pocket costs are rising too. I think I have a slide on that one somewhere. There we go. And you know, it's particularly noticeable in recent years with the increase of high deductible insurance plans. And that's really because health insurers are grappling with that last slide, grappling with those rising costs. And what's happening is that we're seeing more and more costs shifted onto patients, shifted onto individuals, rather than taking a step back as we may really actually need to do and redesigning a system based on these new treatments, these new needs, people living longer with chronic illness. You know, I think one of the things we see as we look across the spectrum of CF and we talk to our peers and other patient advocacy organizations is there's often the sense, and I think there's some reality to it, that health insurance plans don't really distinguish between something very high value in care that's really producing amazing outcomes and that's expensive, and something else that's expensive and maybe not having nearly as much efficacy. They see things as costs rather than for their value. And they're using the same tools to manage those costs. They're using the tools to manage a bottom line without much differentiation in what we're getting out for the money. And I think another piece to think about is, especially in the US, healthcare is really a transactional system.
Transactional. That sounds true to me. But could you elaborate on what you mean by transactional? Because it feels like healthcare should be a relational engagement, and yet transactional feels like a right. What do you mean when you say transactional?
Well, I think and hope that when you're with your care team that it feels very relational, right? That's a goal and I think a hallmark of the CF healthcare system and care center network. But when it comes to how you're paying for it, it is very transactional. You pay for items. You pay for a visit with your doctor. And often what we see in health insurance plans is if you go to your care center visit, you're not just paying for the visit, you're paying this copay to see the doctor, this copay to see the nutritionist. Oh, and if we're gonna see the respirational therapist, that's another copay. You're paying for your prescription, you're paying for your imaging. It's piece by piece by piece, instead of more comprehensively what we would like it to be of what are we paying for the care you're getting, for the outcomes we wanna see. That's not where we are, and you are feeling the pain of that as you navigate that.
Yeah, for sure. Yeah, describing it as painful seems like a very accurate way to describe it. And the part that I think that feels really difficult for me is it sounds like what you're describing as something that needs to be changed at a fundamental level, and yet here we are without that reality. So what do we do from here?
Well, I think unfortunately with the reality is that we know come trade-offs, right? The reality of those increasing costs, the reality of the increasing shift of cost of care onto patients. We know that there's trade-offs of delaying care or going without, and we particularly see this in CF.
Yeah.
I think cystic fibrosis is really a bellwether in the healthcare system. We have these amazing stories. Mike talked about it earlier, like one of the best stories in medicine for what we're able to do and change the face of this disease. And you see that bellwether on the positive end in the transformative therapies that we're getting, and also the amazing story of care, right? Which I think we're gonna be able to talk about, but you also see it on the pain points. And you see it in the healthcare system's cost to patients because of those high costs associated with a lot of utilization of healthcare. So CF is existing in this expensive system, right? We showed you that our early graph of just in general rising costs. Costs continue to rise, costs continue to shift to patients, and the people who feel it most are you, people who are with chronic illness and using healthcare a lot.
Yeah, for sure. One of the things that I have the ability to do as being part of the National Advocacy team is to be able to carry some of these concerns for the larger community, which is really great. But one of the things that's really daunting about that is realizing that not only are our personal concerns heavy for us to lift, when I look out to the community, I see people carrying much of the same and even more complex issues with us. And I think one of the things that's really frustrating as parents who are trying to navigate, we have 2 kids that we're managing with this disease, is how much it feels like we're micromanaged by the insurance companies, meaning they want to have paperwork, follow-up, phone calls, rejections at every step along the way, which just sounds ridiculous. Does it have to be that way? Why does it feel that way?
Well, I don't think it has to be that way, but one reason, when we were talking about this panel, you said, why is it? And here's a statement. This is a very famous paper that's about 20 years old, and it's by a very famous health economist. I'm a healthcare geek, so I think he's really cool, Uwe Reinhardt, and he riffed on Bill Clinton's famous campaign line, and this is why. It's the prices, stupid. It's not you, Jeremy.
Yeah. Probably applies though. Yeah.
US is an outlier. The prices, those charts, that's why. So I don't think CF is targeted. I think that notion of the US paying more for healthcare goods and services than any other country, more for a doctor's visit, more for imaging, more for drugs, more for you pick what your kids are using, you pay more for it than anywhere else. It's a statement overall of the cost of the system. And it's also a statement of the sense of micromanagement, because when you look across the board in healthcare, the US doesn't necessarily get more value for that money it spends. The outcomes in the US overall trail behind other high-income countries. So we spend more and we get less. The thing is, and it's really frustrating in CF, that's not true in CF. CF stands out. Remember I said we're a bellwether. We have significantly better long-term outcomes from investing in evidence-based care. We know our model works. We have a care model that improves care. We have robust new therapeutics that continue to bring new therapies into that model. It's based on evidence. We know what works. We learn from that data. We adapt in the care center model. We improve care. You see continued improvements in outcomes. Mike shared the biggest stat that we have out there in life expectancy. We keep doing better. We're getting better outcomes. But it's another place where CF is an outlier, right? We're pretty unique in the CF community in our ability to rapidly improve care, to adapt new treatments, to standardize best practice across the network. And so a lot of that micromanagement you're feeling is sort of a reaction comprehensively to trying to drive best practice. In CF, there's not that much fat to trim, if you will. We have a really remarkable story led by the registry, by the care center network, of a rising tide lifting all boats. So yeah, you are being a little micromanaged, and perhaps you shouldn't be, but it's in part of that overall system.
Yeah, I mean, one of the things that I've heard people say when they talk about healthcare is that if we make the costs rest on the patient, they will make more judicious choices about how they engage in the healthcare system, and if everything's covered, they'll just go to the doctor willy-nilly and spend all kinds of money and all
An
of these
MRI
things.
every day.
Yes,
Yeah,
which is, everyone loves to do it. Let's go in and get some more tests and let's take more drugs, yes. And it does feel like, I know you said we're not being targeted, and I want to believe you, but it sure feels that way. And I think I understand what you're saying, because the costs and the complexity of our disease are large. Therefore, the blunt instruments that the healthcare industry uses to try to control costs get applied to us, even though maybe they don't necessarily apply in any way that makes any logical sense, which that part rings true to me, no logical sense. Because one of the things that is so frustrating to us as parents, and if you want to stop and talk to my wife during the next break, she'll attest to the truth of this, is, I think I said it to you yesterday, I would have expected that the daily healthcare care for our sons would be the biggest burden of our cystic fibrosis journey. And honestly, in the day-to-day, it's upkeep of insurance, grants, pharmacies, doctor's visits, all of the stuff that goes on. I mean, if I could go on a 20-minute rant about pre-authorizations at the drop of a hat. And what seems so maddening to me is they want pre-authorizations every, 6 months for a condition that does not change. And we have to jump through all of these hoops. Does anyone else experience this? Am I the only one? Raise your hand, yes? Okay. Okay, I want to make sure that we're all on the same page here. It seems crazy that we have to jump once again through the hoops of pre-authorizations for albuterol again. And because the disease is so complex and there's so many pieces to that puzzle, honestly, I come home and Rachel has spent 6 hours on the phone. And there are days when she's in tears, not because of fear of the outcome of her children's life, but because of the frustration with dealing with phone calls with people that put hurdles in her way. What's the heck?
Going on? Yeah, I mean, we're gonna keep trying to explain it, although of course there is no logical explanation. I think one of maybe the worst ones we see, because we monitor all of this very closely, is, do you still have cystic fibrosis? Yeah.
Yeah.
Yeah. haven't gotten that cure yet. You know, some of those extremely frustrating components of insurance experience, like let's take prior authorizations. Oh my
Right.
gosh, the bane of your existence, the bane of anyone with CF's experience. I know any physicians and nurses and other care team members in the room or online would say the bane of their existence, prior authorizations. So let's step back and figure out if there's some logic to there. The logic, broadly, the design is with the purpose of trying to drive those best practices in care, right? So I'm gonna make sure that that's really what you need. Is that really the right thing? The insurers are putting those in place with the hope of trying to deliver better care. Let's give them the aspirational, give them the benefit of the doubt.
That's kind of you.
Okay, I'm trying to be nice. But the things that they're trying, I do think are particularly unnecessary in CF. This is conversations we try to impart on them. We've already done that driving of best practice in care. We do that through the care center network. We do that through the registry data. We do that through things like an ACFC of, hey, let's look over here and see what Denver's doing really great, and how do we impart that across the care center network? We've again, trimmed the fat. And so it's, I think, even more justified in being extremely frustrated. But since we're such a small portion of the insured population, health insurers don't see the value in carving out something unique to CF. And believe me, we've asked, we'll keep asking, and we'll keep trying to share what we see and what we know. But it is, we are a small island in a really big sea. And I think, again, I know some of the other frustrating components, not to justify them, but to try to explain why are we seeing them. Things like having to use multiple different pharmacies, finding out that your care center is out of network from your insurer. Those are based on deals brokered by your insurance company and hospital networks or the drug manufacturer. And it's just part of the cost equation. And I think it really, again, if we're trying to explain, trying to have some logic in all this, it showcases another thing that makes the US healthcare system unique compared to other countries, in that healthcare is a business here. And businesses work to make profit. That's what they do. That's capitalism, right? And we have to be frank. I'm trying to sort of explain why they're doing this, but insurance companies use strategies that can delay care and increase patient out of cost to decrease their own cost and raise their own profits. So
look, what you're saying is, because things are expensive and there's a profit that needs to be made, there's, one of the words that my wife uses a lot is the system seems so intentionally opaque.
Yeah.
Like it's designed to keep me from actually understanding what's happening at any moment.
Yeah.
We feel that a lot. And the other thing that I'm hearing is that there's friction injected into the system, because friction does effectively reduce costs and increase profits. I mean, that might be a crass way to put it, but that's what it feels like.
I mean, there's some industry term, I'm not gonna get it quite right, but it's about pushing delays. It's called adding friction.
So essentially, if there's enough friction put in front of me, maybe some percentage of people will just quit, and that'll save money. Which friction, if I need to have knee surgery one time in the course of a decade, some friction in that experience is annoying. But when I experience that friction every single day of my life over decades with multiple children, I gotta be honest, it can be very overwhelming.
Yeah.
So how are we seeing this play out? I'm guessing that, one of the reasons that we talked about doing this conversation is to be able to hear from parents who are experiencing this kind of thing. So what are we seeing, and what are the effects of this?
Well, they're not good. So we recently published a paper that looked at the impact of cost of care on access. And the data is sobering. Despite the fact, good news is that nearly everyone with cystic fibrosis has health insurance. That's another unique component of our community. We are quite insured population. So more than 90% of people with CF are insured for the entire year. That's a lot compared to the US general population. But even among them with insurance, 3 in 4 use financial assistance programs or grant programs to cover or offset their healthcare costs. One of the leading researchers who worked with us on this paper described having CF as, and covering and paying for it as being a team sport. You can't have, it's not a solo act, right? You need a lot of different pieces of the puzzle to put it together. So even with all those supports, you see here on the slides that nearly half reported delaying or foregoing care due to costs. And those costs also force people to make trade-offs in their lives. 2 in 3 told us that their concerns about their insurance status have affected major life decisions. Am I gonna get married? Am I gonna take that different job? What kind of job should I have? Should I move to a different state? So it's exactly what you said that you and Rachel think about for your own self. You know, those financial pieces are often another huge looming component of cystic fibrosis for many, many people. So, you know, it does really impact us. And I think we also can't underestimate exactly what you said, the huge patchwork, creating a huge administrative burden to navigate the system, even for the savviest among the community. You know, you just shared about Rachel scouring for insurance plans, searching out the best financial assistance, finding different grants, jumping through hoops and spending hours on hold. And the other piece adding to that frustration is all the different players, right? The insurance company, the pharmacy benefit manager, your care team, Compass, hopefully, manufacturers of drugs. It's a full-time frustrating job. And again, not just for people with CF, their families, but also their care teams.
Yeah, I mean, when I look at that slide and say facing financial burden, yes. Facing debt issues because of medical costs, yes. Scouring for all of these grants and copay assistant programs that will help us with this. That is a level of expertise that I never assumed would become part of what cystic fibrosis is. And when you talk about trade-offs to care, we've definitely experienced those kinds of things in our life. And I'm guessing, based on the research, that that's not a unique experience to us. When you say trade-offs, obviously there's ones about financial burdens and cost worries. What other kind of trade-offs are we talking about?
Well, I think it's, you know, with any chronic illness, but I think particularly we see in CF that notion of what do I need to have the best care I need? And you know, I know I've talked to many of you in the audience about making life decisions about that. What should I take this different job? Am I able to go out and you know, start out on my own, or do I need the stability of
Right.
a bigger company and a bigger insurance? So those are the kinds of things that we see.
I remember when we were first diagnosed, one of the things that we made like deep commitments to is that we will do anything to make sure that our boys have the best care that they can. And I still deeply believe that. And we do our best to do that. And yet the reality is you get into certain situations where suddenly there is another quarterly visit that comes up with your care team. And we love our care team. They do an amazing job for us. But we're looking at a stack of bills from the last hospital stay and the last quarterly visit that haven't been caught up with yet. And we try to put that off. That has happened in our life. And then we realize we can't because we need a pre-auth that has to be approved by our care team in order to get the Trikafta that we need in order to provide for them. These are very real burdens for families. And you know, I don't think that I'm the only one that's feeling this. And I also know the kind of burden that it puts on our CF care team at our local hospital, Phoenix Children's Hospital. They're an amazing team, but they're also overwhelmed, not just with the care of our kids, but with the management of the back end bureaucracy that exists in trying to manage all of this stuff on their end. And that can be incredibly frustrating. One of the new things that's come up, and hopefully I can jump us to this topic, is this idea of copay accumulator programs. Okay, I'm gonna say it again, copay accumulator programs, and then I'm gonna admit that I've had training on this. In fact, I may have been in multiple senators' offices talking about this issue, and I still, just amongst my friends, I'm not really sure what that actually means. copay accumulator programs, it sounds like it's intentionally designed to describe something that's the opposite of what it is. Is that fair?
I
Can
think
you want to
that's
talk about
fair.
it for a second?
I mean, full disclosure, it took me about 6 months to be able to actually explain it to somebody else when these things first started. No, I think this example of accumulator programs, and we'll explain that a little bit in a second, but it's the newest bad action on the table of two big industries, health insurers and drug manufacturers, slamming into each other over profit. You know, payers and manufacturers we see repeatedly ratcheting up tactics against each other. And here again, unfortunately and unacceptably, people with CF and patients in general have been caught up in the middle. So let's go with accumulators, right? What have we seen in CF? How are we actually seeing this? It came to a head late last year when Vertex Pharmaceuticals decided to reduce the amount of copay assistance, which we'd said earlier is really important, right?
Absolutely.
A really vital tool to help people afford their care. When they reduced the amount, it offered to people with CF as a way to get around some new approaches from health insurers to manage their costs. So the programs aren't specific to CF, and they are a blunt instrument that's designed to steer patients to lower cost drugs, right? That's what the health insurers have put them out there, to have these accumulator programs put out there. They're designed to have a patient choose the lower priced drug rather than the drug that may have a more generous copay assistance program. But here again.
So can I try to explain how
Yes,
what I think
please.
this means? So I'll use examples that pertain to us. Trikafta, which is a life-changing medicine for our family and many families in this room, is a very expensive drug.
Yes.
Therefore, it goes in the highest category of our health insurance copay categories, at least in our plan. I don't know if they're all like this. There's tiers of copays. Trikafta's in the biggest one. And so Vertex, in order to help us, has said, well, we'll cover your copay for you. Am I right so far?
You're doing
okay, great. And because my health insurance also has deductibles that I have to meet every year and out-of-pocket maximums I have to meet every year, the way the system has worked is that when Vertex gives me that copay assistance, that goes and gets credited to my deductible and my out-of-pocket maximum. And for some reason I cannot quite understand, the insurers have said that that's an unsustainable solution, and so they've said no. That doesn't count? Is that an accurate assessment?
You got it.
Okay, and the reason that they're doing that is so that I will say, oh, you're right, Trikafta's too expensive.
Just go get some Tylenol.
Let's get the one that's cheap. What's on your generics list?
Exactly.
Yeah, okay.
Yep, you got it.
You see where I get frustrated?
Yeah,
Okay,
I do.
okay, I'm just glad that you're with
You're
me.
allowed to be frustrated.
Okay, great.
Yeah, and I think, you know, again, with the accumulator program, here's again another place where CF is not the problem they're trying to solve, because as you just aptly stated, there aren't lower cost alternatives in CF.
Right.
You can't just go to the generic Trikafta, we don't have it yet. And so the result is that people with CF were quite surprised, unpleasantly so, to receive bills of $6,000, $7,000 or more when they filled their modulator prescriptions. Now, thankfully, most people have been able to stay on their modulators through this change, this implementation. That's good. But let's also be real, and you've been very real about this, that heavy administrative burden that this change placed on people with CF, hours and hours and hours spent by thousands of families. Significant stress and anxiety should not be understated. And unfortunately, not everyone has the capacity to navigate these changes, and we know that there are people with CF who've experienced gaps in their treatment, gaps in their modulator care because of these costs and because of these changes. Now, I have to say, also, it's important to note that accumulator programs and other programs that shift greater costs onto patients, they're more acute in populations of color, the kinds of plans they often carry, adding to the systemic barriers that these communities face and adding to health disparities. And let's state the obvious, none of this is okay. It's not acceptable. and people with CF should not bear the burden of the
Preach.
system that's not working as it should for them.
That's right.
It's not okay.
That's right. You're right. It's not acceptable. That's right.
So what are we going to do about it, Jeremy?
Well, let's put our cards on
Wow,
the table.
geez.
I know it feels like this has been hey, happy lunch. What a bummer. Your life is hard and there's no hope on the horizon.
Okay,
Oh,
but
wait.
no.
Wait, maybe there is, Mary.
Come on,
Is
let's
there
go up the
hope on the
mountain.
horizon? Okay, let me ask you, like, what is the foundation doing on these issues? And then maybe even more importantly, because this is a conference dedicated to people who don't take no for an answer and are always looking for ways to fix things, what can we do?
Okay, let's do this.
Let's.
Okay, so let's be clear. Part of the mission of the CF Foundation is to tackle this. The work to ensure that everybody with CF is able to access and afford high quality specialized care that they need. It's a high priority, and it's a key focus for a whole team of people in multiple departments that work on it every day. And the great news is we have tools in our toolbox. We have wins that I hope we can talk about, and they're all powered by the CF community. You know, data drives this community, right? Data drives our scientific development, data drives our care, data drives our advocacy. We collect data on access, and cost, and social risk factors to understand these challenges, and then we go and talk with the decision makers about that data. And this data-driven approach, I do think, puts us in a different category. We are the CF Foundation. The story of CF is listened to differently, and we have credibility because we are data-driven with decision makers, and it increases our effectiveness. And it's only possible because the community members, you all, share your experiences, share what's happening to you on a topic that's really personal and challenging. And you know, one of the really real ways we get that is every day in real time through our calls to Compass. We help people, I hope everyone knows about Compass, but it's an amazing program that helps people one-on-one to navigate challenges and find solutions. And something that I'm really proud of is last year alone, Compass helped people with CF save over $1.3 million on medical expenses. And the average savings per person was $7,400. Right?
That's huge.
It's huge. It's about identifying additional resources and helping to navigate through the insurance barriers. So that's just one piece of the puzzle.
Yeah, that's huge. Compass is, it's interesting how much my thought process on advocacy has shifted over just the last couple years and seeing what Compass does as real advocacy for our community. Because I think when I think advocacy, it typically is how are we working with public policy and lawmakers to change the laws of our nation to make it more favorable for healthcare equity and all of the things that we talk about usually. Are there other ways that we are advocating that don't maybe necessarily fall into policy and healthcare? Are we having conversations with insurance companies and pharmaceutical companies and that kind of thing? Is that part of what is happening?
Thank you for asking.
Yeah, it's almost as if we planned this.
Guess what the answer is? Yes, we are. You know, Compass is very much a finger in the wind for us. When we hear what individuals are telling us through their calls in Compass, it's often a kicker for us to dive deeper and take a bigger look. Is this just this one person's experience, or is there something more systemic going on? And we also hear it from care teams, right? They're calling us and flagging, hey, this has changed. And so some examples, like a not infrequent one is a care center becoming out of network for a particular insurer. Those are places we dive right in, and we work with the care center or care centers and the insurer, meeting, writing letters, working very closely with the care center team to say, hey, no, you got to figure out a carve out. And usually we're very successful of like, there has to be a way for people with CF to get the specialized care. Even if you're not contracting with the giant behemoth hospital, you got to find a way for people with CF on your plan to see their care centers. And that's like, actually, we're actively working on that in Southern California right now. with a lot of Medicaid populations, working hand in hand with multiple care centers on access issues of making sure. And as I said, almost always, not always, but almost always we're able to find a solution. And again, because we're bringing that data and those experiences, the insurers look at it differently and are willing to work with us. Also flagging that we met with many major insurance companies before the approval of modulator treatments to explain what was different, to explain what was coming down the pike, what we were seeing scientifically, why we were excited about it, and its opportunity to change the face of CF. So we are having those conversations fairly routinely about a lot of specific things.
So I just got done saying that advocacy is not only just policy and lawmakers, but it's largely policy, lawmakers, relationship building. What kinds of things are going on right now in the advocacy sphere that might be interesting to the people that are listening, that might be encouraging to them, things they could get behind? Anything on copay accumulators?
Yeah, well, maybe you can help me with that one.
Yeah.
I mean, I think first, there's big bright spots that we were pretty excited that happened in 2022 that are because of advocacy. So we absolutely advocate every day for policies to improve cost and access for people with CF. And we do that working side by side with the community. And like I said, we've had some key wins, and let me flag a couple. In Medicare, more and more people with CF are aging into Medicare, which is pretty exciting. But about 15 or 20% of all adults with CF are on Medicare primarily through disability. So the Medicare population of people with CF has been pretty stable, and they had a massive pain point in the form of I'm not gonna get into it, but the way Medicare was structured on how it paid for particularly high cost drugs left people with CF with astronomical and often unaffordable drug bills for their prescription drugs because they had a 20% copay for a CF therapy after a certain dollar amount. So 20% of a modulator, that's a lot of money. So for probably a decade, we have been advocating alongside many other patient organizations with the stories of individuals with CF who are on Medicare on this is their personal experience, this is not sustainable. And last year, as part of the Inflation Reduction Act, we were thrilled that they placed a cap on out-of-pocket costs for Medicare. I just want to say that again, like this thing that seemed insurmountable and was going on for so long, it happened.
Yeah.
It happened last year, and this major change that I think cynics in Washington, sometimes I'm one of them, never thought would happen, happened because people stood up and shared their story and said, this isn't working for me. And now, starting next year, people with CF and many others on Medicare will have a cap and will not have to pay these astronomical fees. That's huge. Another thing that law did was cap out-of-pocket expenses for insulin at $35 for Medicare. Now, you may have seen in the news, in just the last month, the 3 largest manufacturers of insulin announced that they will be proactively dropping the price of out-of-pocket insulin to $35 across the board for private insurers. So let's be darn clear. That's not just out of the goodness of their heart.
Yeah.
Right? That is because of the law that went into effect and they saw what's coming and they wanted to act on their own before having the government tell them how to do it, and because people spoke up. Because they shared their story.
That's great. Yeah. Well,
accumulators.
Yeah, accumulators. I mean, we were just in Washington 2 weeks ago for March on the Hill, and one of the things that we were advocating for was for the HELP Copays Act, which includes a national copay accumulator program ban, which would be massive because 16 states right now have those bans, but this would make it a national.
Well, Jeremy, how did those 16 states get those bans? How do you think that happened?
I think it probably happened through local advocacy.
You're exactly right.
Gosh, that's so good.
Including CF advocacy,
yeah.
Right? I would love for you to talk a little bit more about what you heard on that and how you found that story. But accumulators, actually, I I think CF was one of the first to really notice. The CF community and handful of other chronic illnesses were some of the first to see accumulators coming onto their plans. And so we've been at accumulator ban legislation and lobbying for about 4 years now, at the forefront, and we've been a part of every one of those 16 states banning the programs. And we're proud to be advocating and being a leading voice. You want to tell a little bit more about what we did 2 weeks ago on March on the Hill for this?
Yeah, I mean, we ended up having somewhere in the neighborhood of 200 meetings across congressional offices, all across Capitol Hill, talking about how this impacts our families, how these kinds of cost-saving measures have, I'll call them unintended consequences, but the reality is we're just feeling the intended consequence in a way that is untenable for our community. And being able to walk into those offices and share our stories and demand that something be done on this. And it's really helpful to feel the empowering nature of being able to share your story and the concerns that you carry for your community and have people that have the levers of power that can really do something about it, listen to you, and to take action on those things. So we're really excited about the stuff that we were seeing move forward on that issue. It was a great time. March on the Hill is an incredible experience, and we're honored to be able to be a part of it, including on things like this copay accumulator issue.
Yeah, I thank you.
Yeah.
We can talk about that more in a second. I think another really important thing, so, yes, it's great that we've banned accumulator programs in 16 states, but it's a lot easier to do it at the federal level. So that's why the Washington work is so important. And another piece of that HELP Copays Act is that it closes a really concerning loophole that allows insurers to deem certain types of treatments, certain types of drugs as non-essential health benefits. It closes that loophole. So we got some work to do because we need to make sure that passes. We gotta, I think, to be honest, there's a game of whack-a-mole. This is the one today. And that's why we need to advocate consistently, because we have to defend what it means to have high quality, affordable care. And another thing, we talked about prior authorizations. Can I brag a little bit for a second? One thing we're also really proud of is we've worked with the American Medical Association, which is a pretty powerful bunch. It's the largest medical association in the country, to propose legislation that would extend the time of prior authorizations for medications prescribed chronically to 12 months. And so we're working on that. That would be huge. And that will probably happen at the states first. But so these, there's a lot of moving parts. We talked about all the complexities earlier. There's a lot of moving parts, but none of them are going to happen if we don't get into the mix.
Yeah, that's exactly right. So I know we're getting close to the end of our time here. There's one thing, I don't know if you were planning to talk about this, but it was a story that you told me yesterday and I thought was really encouraging. So you were talking about some legislation that's being proposed about dealing with the lack of healthcare workers, particularly post-pandemic, and how the foundation has played a part already in that. Can you share that story? Because I think it would be encouraging for people to hear it.
Sure. This is a bright spot, and I know Washington's getting a bad rap, probably deservedly so sometimes lately, for the lack of movement and momentum and the lack of bipartisanship. But one bright spot we're seeing is, particularly in the Senate, a strong agreement that we've got to do something to help our healthcare workforce that got really battered, particularly in the pandemic. And so the two leading senators who oversee healthcare legislation, one of whom is a doctor, have been holding hearings and talking about what we can do to help the healthcare workforce and stabilize it. And they held a couple hearings and they asked for feedback and for folks to share ideas about what they were seeing and what they thought would work. And they actually proactively reached out to the CF Foundation. They said, we really want to hear from you and what you're doing and what you're seeing. So we just submitted a letter, which may not sound like much, but it is the currency of Washington, to put your stake in the ground, talking about what we see in CF healthcare and the pain points that we're hearing from our patients and from our care teams, and also what we want to do about it. And this is one of the things I love about being able to carry the flag for people with CF and the CF Foundation is because dang, do we put our money where our mouth is, right? And one of the things that actually Mike pointed out that we put in the letter was the Cystic Fibrosis Foundation, through its grants and fellowship programs, supports almost 60% of all pediatric pulmonary fellows in the country.
That's huge.
Right? That's huge.
Yeah.
So for us to be able to not only say, here are the problems we're seeing, we are concerned about how many pulmonary fellows, particularly in pediatrics, are coming through and are going to be available to help take care of people with CF and any other kid who might have a pulmonary issue. And here's what we're doing about it. Again, almost 60% of all the trainees are because of our funding. And here's what we need you to do about it. And so they listen differently when we're able to say that, and they're talking with us to share more and learn more about what we're doing and what, where we see the gaps and opportunities.
I can't overestimate how helpful it is when you're doing advocacy to be able to demonstrate how the foundation is not waiting for the government to move in these actions. We're already there, we're already spending that money, we're already doing those things. We were in, one of the other things we were advocating for at March on the Hill was the Pasteur Act, which is to develop new antibiotics, and to be able to say to legislators, we think this is important for you to get in the game, and we think it's so important that we've already spent $135 million over the past 5 years in this space, and we want you to join us in it. It makes us not just someone who needs help, it's someone who's saying, we're already leading in this area, follow our lead. And that is so massive, especially for a community that's as small as ours. Our voice is so much larger than our footprint. And would you give me the opportunity to try to empower these people to help us more? Would that be all right?
If you did that.
I think we have a slide in some ways. I'm gonna try to leave you with some things that you can do to help us. So here's some of the things that we need. First one is, we need you to tell us our story. If you're part of the CF community, if you've done fundraising, if you've galvanized your friends and your family to be involved in your events, if you've done advocacy, you already know how to tell your story. But one of the things that's really interesting is that the foundation can take your stories and put them in what they call a story bank, which means that anytime there's an opportunity to advocate through legislative priorities, through op-eds, through stories that the New York Times calls and says, we want to do a story on this, they can then go to their story bank and find stories of yours and the way these things have been pain points in your life and immediately turn around and share your story. They don't have to think, okay, who do I know that's experienced this and how can I get in touch with them? And so here's what you can do. You can text story to 96387 and it will take you through a prompt system that will allow you to answer questions that will fill their story bank with stories that will help them as they push forward in these areas of advocacy. Now, I will warn you, it might take you a little bit of time because they want to get your stories. So it's probably not something that you're going to sit and do right now because I'm still talking. But, right after I'm finished, you can get started. But write that down, text it and get the first prompt, and then you can start responding later and get those stories in because they are hugely valuable. Mary used the word currency. Your stories are currency that allow us to make powerful action. And I think we might have, is there another slide? That's the one that we have.
Just seared in their brain.
Yes, that's the one. We're just gonna cook it into your brain. We need you to tell these stories. We already heard earlier about how you can text to get CF advocacy updates. You should be on those advocacy alerts. This is a massive way that we can ensure that the magical work that the foundation has been doing on behalf of our families, our siblings, our parents, our children, is accessible by us in the future. I remember years ago when I very first started getting into advocacy, I would paint a hypothetical picture, like how tragic would it be to develop miracle drugs and treatments and therapies for our community that then we would not be able to access because of healthcare hurdles. The reality is that is right in front of us. These miracle treatments are right here. And there's new stuff right around the corner. Mike was teasing us about the science that we're going to be hearing. There's stuff coming right now. So we need to be ahead of the game. We need to be pushing hard to make sure that our legislators know what this means to our community, and you need to be part of it. Advocacy cannot be seen as an optional part of CF life. It needs to be a vital frontrunner for how we change the story in this community, and I need you to be involved. I'm begging you. Join us.
Thank you.
Are we good?
I think we're good. There are a lot of advocacy team members or any of our colleagues, because they're also into advocacy. Ask us after this, but thank you so much, Jeremy.
Yeah,
and listen to Jeremy.
Yeah, text story to 96387 today. Thanks, everyone.
Thanks, everyone.